Good people, welcome back to my channel, and in this video I'm going to talk about a very important rising concern in the people, which is obesity. And the problem with obesity is being a metabolic syndrome. A part of that, it can cause a lot of eye problems. So being an eye doctor, I want to bring it forward that what are the sight threatening eye conditions that can happen in people who have obesity. And when does this happen? Who gets it? If somebody is overweight, he can get it. When do you call somebody as overweight? Is when their body mass index is between 25 to 30. And if the BMI goes above 30, it's called obesity or obese person, unfortunately. So eye health is affected at any BMI over 25, whereas there are some conditions, I will go over that in future in my next videos. For example, stroke related vision loss that can even be associated with a BMI of any number above 20 as well. So this 25 is a good reference, but be aware that yes, you need to have a BMI below 20 ideally, but if you are above 25, then the things are going south. And what are those conditions? Let's jot them down, let's discuss them. And again, here I am bringing them forward, but in my future videos, in my series of next few videos, approximately 8 videos or so, I will be elaborating all those conditions in connection to obesity. Number one, top of the list, is diabetic retinopathy. It is very common in obese patients because obese patients get diabetes quite frequently. And diabetes can lead to something called diabetic retinopathy, and diabetic retinopathy ends up with blindness if not addressed appropriately on time. Second thing is cataract. Again, cataracts, diabetic retinopathy are the sight threatening conditions that can happen in obese patients or obese people. Retinal vein occlusion, another sight threatening condition, can happen to obese people. Stroke related vision loss is very common in patients who have obesity, who have high cholesterol secondary to obesity, and then they end up having stroke. And stroke can happen to any part of body, and just like that, it can even happen to the eyes. And when it happens to the eyes, it takes away a lot of your vision depending on the area of involvement and things like that. Age-related macular degeneration, unfortunately, it's another condition that's very commonly associated with age, but in addition to that, obesity is another additive factor into that. I will elaborate that in my future videos, so please stay tuned. Floppy eyelid syndrome, another ocular condition associated strongly with OSA, obstructive sleep apnea, which is strongly associated with some sight-threatening ocular conditions. Idiopathic intracranial hypertension, very strong correlation with obese women especially, is another sight-threatening condition that can affect your vision drastically if not addressed appropriately or on time. So those are the sight-threatening major ocular conditions that I'm going to discuss in my upcoming videos. So please stay tuned, because obesity is something that you can manage if you nail it down in the beginning, in the early part, or sometimes even in the later stages, depending on your BMI and other aspects. So this is something that you can get rid of and avoid those sight-threatening conditions, because you don't want to end up into blindness from stroke in your eye. You don't want to be blind from age-related macular degeneration. You don't want to be blind from diabetic retinopathy, and so on and so forth. So please stay tuned in my next videos and ask me if you have any questions in the comment section. Thank you so much. Have a great day. Bye-bye.